Hello, my name is Amber Perez, and I'm going to be discussing with you today the use of the incentive spirometer to prevent postoperative pulmonary complications. Pulmonary complications are the most common cause of mortality and morbidity postoperatively. The implementation of this handheld device can decrease the risk of pulmonary complications exponentially by increasing the inspiratory rate of the lungs. There are two primary types of incentive spirometer that I'm going to be discussing. There are two primary types of incentive spirometer. These include the low flow and post work of breathing spirometer and the high flow and post work of breathing spirometer. The high flow spirometer is flow oriented and therefore is most appropriate for other areas of respiratory treatment. The low flow spirometer is volume oriented and therefore allows for improved maximal sustained inspiration. This is our goal in preventing postoperative pulmonary complications. Studies have shown that the low flow and post work of breathing spirometer is most effective in decreasing the incidences of pulmonary complications in postoperative patients. This is very important for us to know. Selection of the correct incentive spirometer can make the difference between successful prevention and rapid decline.
Doing good in yourself?
Good. I see that you're on the schedule to have your gallbladder out next Friday. And so I had you come in here so that we can talk about this breathing device that I'm going to have you use to try to prevent getting pneumonia and other breathing difficulties.
I've had pneumonia before. Let me tell you, it sucks.
It's even harder to get over pneumonia when you've had an abdominal surgery. But this device can decrease your risk of getting any complications after surgery. So what I'm going to have you do is show me that you can do this, and we're going to do it before surgery and you're going to do it again after surgery. I have a handout here that we're going to go over, and I'm going to have you use the device for me. What you're going to do is put your mouth on this mouthpiece and hold on to the handle here, and you're going to take a long, slow, deep breath, and we're going to look at the numbers on this chamber and see how high you can get to develop a baseline.
It didn't move.
You almost have it, but instead of blowing into the mouthpiece, you're going to put your mouth on, you're going to take a long, slow, deep breath like you're sucking on a straw.
Like a straw?
Yes. Good, you got 2,000. That's a good goal. That's a good place to be. We want to maintain that goal, but I'm going to have you do it a couple times to make sure that that's where your baseline actually is. Wonderful. Give me two more. Alright, it looks like 2,000 is about your baseline. What I want you to do is do this every hour, 10 times an hour, all the way up until surgery, and then after surgery we're going to restart the program and try to hit 2,000. After surgery sometimes it's harder to take those deep breaths and to reach the same goal as you did prior to surgery. But by starting it now, we increase your chances of not getting the pulmonary complications, and so we're going to go ahead and start now.
Okay.
Do you have any questions about how to use the device?
I hold it, I put it to my mouth, and suck on it like a straw.
And how often are you going to do it?
You said 10 times every hour?
That is correct. Your baseline of 2,000 is wonderful, and we're going to make sure that we maintain that throughout. I need you to make sure that you bring this device back at the time of surgery.
Okay.
We're going to see you on Thursday. We're going to see you on Friday morning at 6 a.m., but I need you to be NPO after midnight on Thursday night, so nothing to eat or drink after midnight Thursday.
Nothing to eat after Thursday night, and see me 6 o'clock Friday?
That's right, 6 a.m.
Okay.
We'll see you then.
Thank you. Do I get to take this with me home?
Yes.
Thank you.
There's minimal cost involved in the use of the incentive spirometer. Some of these costs include nursing wages for implementation and follow-up care in the use of the incentive spirometer, respiratory therapist wages if a respiratory therapist initiated treatment, the cost of the incentive spirometer, which on average is $3, time due to wages lost during the inpatient time for the patient, and follow-up care, whether or not the patient acquires a pulmonary complication. The incentive spirometer is much more efficient than chest physiotherapy. The other treatment options that have been utilized in the past have been much more costly by comparison. Chest physiotherapy costs on average 3 times more to implement and maintain than that of the incentive spirometer. In the end, the most efficient and effective means of prevention for postoperative pulmonary complications is the incentive spirometer. Thank you.